So this is the explanation of, because it is recording, please be silent, brother. Okay. So this is the explanation of the handout inflammation. Okay. So this is the cardinal signs of inflammation. This is called cardinal signs, means clinical signs of inflammation. Okay. I explained this in the video also, you can see it. I took it as an example pimple. Okay, how it becomes red, how it becomes tender. Tender means if you touch it will become painful, then it swell, then it will become warm, and they will go for loss of function. It is a stepwise. Okay, there are 5 cardinal signs of inflammation. One is redness, tender, swelling, warm, and loss of function. Okay, so inflammation is a protective response which helps to remove the necrotic tissues, cells, as well as to remove the bacteria, viruses sometimes. Okay, and it is there from the birth. It is called innate immunity. Okay, so there are 2 types of inflammation: acute inflammation and chronic inflammation. Acute means very fast, rapid onset, and it happens within few minutes to few days, very short duration of time. And what is the characteristic feature of acute inflammation? The plasma fluid escapes out. Okay, you all know why it escapes. Okay, and the cell involved is neutrophil. Okay, and chronic inflammation, it is very slow onset, insidious onset, and it is there for longer duration, from days to years, and it is characterized by a mononuclear leukocytes, that is lymphocytes, monocytes, and macrophage. Monocytes, when come out of the blood, it is called macrophage. Okay, and they always end with fibrosis. Very, very important. This is the worst side effect of the chronic inflammation. It will always end up with fibrosis. Okay, I told the example of hepatitis virus going to the liver. Okay, it will be there for 10, 15, 20 years, and slowly the liver will become completely fibrotic. Okay, in the video also I explained it. You can see the video. Okay, so now coming to the 2 major changes happens in acute inflammation. First is vascular change. The first thing happens is vascular change. What is that? Vasodilation followed by increased vascular permeability. Okay, you all should have expert now. It is vasodilation, increased vascular permeability, basically by the histamine. Okay, basically by the histamine. Then the cellular events follow. Cellular events is very simple. They take the neutrophil from the blood and they will throw it to the interstitium where it is needed. So the cell which is involved is neutrophil, generally neutrophil, otherwise called as polymorphonuclear leukocytes. We have 3 cells like that: neutrophil, eosinophil, basophil. These 3 are polymorphonuclear leukocytes. Understand? Okay, so this is the vascular changes. I explained it, as well as I explained it in the video. Okay, you can see. Okay, this all I explained it in the video. Now cellular events. I told when the blood cells neutrophil touch the endothelium, endothelium gets activated. They release a protein that hold the neutrophil and they will throw it out. Okay, so this is the thing happens. Okay, it is little bit molecular level, don't worry about it. The concept what you have to understand is the blood cells should travel in the center. Okay, due to the plasma fluid and the plasma protein is going out, the laminar flow is disturbed. The blood cells, that is especially the neutrophils, touch the endothelium. When they touch the endothelium, okay, endothelium gets activated. They hold the neutrophil and they will throw it out. Okay, they will throw it out. Okay, so that is called cellular event. Okay, now it is a summary. Okay, when there is injury, okay, when the inflammation is activated, what happens? There is a vasodilation, the fluids coming out, proteins coming out, cells coming out. The cell is neutrophil, the neutrophil taking the bacteria, killing the bacteria, and they are dying. Okay, so what in that area, what is collected? Fluid, proteins, neutrophil taking the bacteria and dying. Okay, this all collected, and there is some bacteria also. This all are called as pus. This all are called as pus. Okay, so this is the definition for pus. You all having that in your handout? It is the definition for pus. Okay, now it is chemical mediators of inflammation. Okay, so the chemical mediators are the messengers. Basically they are the messengers, so they will tell the other things to happen. Okay, so the mediators are derived from the cell, or it is derived from the plasma. Okay, so in the plasma derived mediators we discussed only about the complement. Okay, inshallah rest of the things we'll discuss in the other modules when it is needed, right? Okay, so in the most of the mediators what we discussed are cell derived mediators. Okay, we'll go one by one. So first, histamine, it is very important. Okay, because that is the thing starts the inflammation, right? Because histamine is released from the mast cells, basophils or platelets, sometimes endothelial cells, and this histamines dilate the arteries. Okay, dilate the blood vessel and increase the vascular permeability. So once the inflammation has to complete, we need to stop the histamine. So we have an enzyme called histaminase. Okay, that will break the histamine. Okay, histaminase. Okay, that will, AS means enzyme. Okay, histaminase, that breaks the histamine. Okay, now it is very important. It is called arachidonic acid metabolites. Okay, the chemical substance comes from the arachidonic acid. Okay, so the thing which we explained is mainly prostaglandin. Okay, we explained mainly prostaglandin. Rest of the things inshallah will explain in the other modules. Okay, so which is very important, I am telling. Okay, so uh, you all know in the inflammation the enzyme which gets activated is cellular phospholipase. This enzyme once gets activated or it is increased, they will go to the phospholipid which is in the cell membrane. They will break the phospholipid. They will break the phospholipid. Understand? They will break the phospholipid and they form what? Arachidonic acid. And they form arachidonic acid. And they form arachidonic acid. Okay. So once the arachidonic acid is formed, we have a special enzyme called cyclooxygenase. Cyclooxygenase break the arachidonic acid and its synthesis prostaglandin. Okay. This speed is okay. Okay. So you should understand the cyclooxygenase pathway is very important. Why? And because they produce prostaglandin. There are different types of prostaglandin. Okay, don't worry. Now you understand prostaglandin, that is enough. Okay, the prostaglandins, what they do is they produce pain and fever. They produce pain and fever. So in the inflammation, the fever and pain comes if there is prostaglandin. If there is prostaglandin. Okay, so okay, so this whole slide is very important. This whole slide is very important because we are discussing about the drugs acting on the arachidonic acid pathway. Okay, aspirin, non-steroidal anti-inflammatory drugs, and COX-2 inhibitors. Okay, I explained it very elaborately in the class as well as in the video. I explained it very slow. Okay, you can see the video. You will get, if you have any doubt, you can see the video. Okay, and you can get my explanations back. Okay, so please read it. Definitely, if I am asking question to a student, I love to ask question in inflammation from this. Okay, so it is my favorite area and it is very important day to day. Day to day we use these drugs. Okay, when you are becoming a clinical practitioner, each day you will not pass without using these drugs. Okay, so it is very commonly used drug. You should know where it acts, how it acts, how it controls the fever, how it controls the pain, right? Okay, so anyhow I explain it in little bit here. Okay, you all know phospholipids are in the cell membrane, right? So phospholipases increase in inflammation and gets activated in inflammation. They will break the phospholipid and they form arachidonic acid. Okay, and cyclooxygenase gets activated. Okay, see, in inflammation, in acute inflammation, the mediators involved are TNF and interleukin 1. Okay, you all know, right? Interleukin 12 is chronic inflammation. TNF and interleukin 1 is in the acute inflammation. They do what is, they will activate these enzymes. Okay, see, last time while I was teaching I didn't tell this. Okay, so every time, no, when I'm taking lecture, new things comes. That is a problem. Okay, so in TNF and interleukin 1 gets activated, understand? Once they gets activated, they are increased in acute inflammation, understand? Interleukin 1. Okay, interleukin 1. Okay, inshallah it is there in the video, brother. Okay, interleukin 1. IL means interleukin. You want me to write interleukin 1. Actually the no, interleukin 1 is a protein. It is released when by the inflammatory cells when they gets activated. Or in acute inflammation, neutrophils release, macrophage release, not endothelial cells, inflammatory cells release interleukin 1. Okay, and TNF. See, when the interleukin 1 TNF increased in the inflammation, they will activate the what? Phospholipase. Okay, phospholipase will degrade the phospholipid and they form arachidonic acid, and again they can directly activate the cyclooxygenase. So cyclooxygenase again break them into and they form prostaglandin. Okay, you forget about this area. Okay, so they will activate the prostaglandin. The prostaglandins will produce what? Pain, fever and pain. Okay, they produce fever and pain. What we are going to do is we will use a drug. If we use a drug steroid, okay, glucocorticoids, it is a very powerful anti-inflammatory drug because they directly block the phospholipase and they will completely stop this mechanism. Okay, complete inflammation stops. Okay, if a person is having inflammatory disorder, okay, for example autoimmune disease, okay, autoimmune disease is nothing but, it's in the name itself is there, the person's own immune system attacking his own body. Okay, it is severe disease. Okay, to here I have to stop the inflammation, understand? I have to stop the immunity. So what I will do is I will give a steroid and I will stop his whole inflammatory process, understand? I will stop his whole inflammatory process. Okay, steroid is used in many of the disease, okay, where there is inflammation is always there. Okay, because inflammation, if there is always, it is dangerous because it will go to chronicity. Chronicity ends with fibrosis, understand? So I am giving example so you will better understand this word. Okay, so name of the enzyme you want? Phospholipase.
Interleukin 1.
They are not enzymes, brother. They are the proteins. Okay, they are called cytokines. Okay, cytokines, kinins are the type of proteins which is released by the cells. That's why we call cytokines. Okay, the cytokines will activate the enzymes. Okay, so if you put steroid, it will completely suppress the inflammation. It completely suppress the inflammation. So we call steroids, glucocorticoids as potent, powerful, strong anti-inflammatory drug. Anti means opposite. Anti-inflammatory drug. Clear? Okay. Now we are coming to the other chemical mediators. Okay, so the chemical mediators, one of them is cytokines, which is involved in acute inflammation is TNF and interleukin 1. The cytokines involved in chronic inflammation is interferon gamma and interleukin 12. Interferon gamma and interleukin 12. Okay, you should not get confused. Okay, acute inflammation, interleukin 1, TNF. Chronic inflammation, IL-12 and interferon gamma. Okay, remember, macrophage takes a mycobacterium, releases IL-12, activate the T lymphocyte. T lymphocyte releases interferon gamma. Okay, interferon gamma goes to the blood. So brother, my simple request is daily go on study. Understand? Inshallah, you will become master in the medicine. Okay. So another cytokines and chemical mediators, okay, are reactive oxygen species, nitric oxide.
So normally
Nitric oxide and okay, these two directly kill the microbes. That's why I'm marking it together. They directly kill the microbes. They directly kill the microbes. Okay, reactive oxygen species and nitric oxide. They are very, very powerful in killing the microbes. And complement protein. See, complement protein also directly kills the microbes. Okay, so these three directly kills the microbes. What are they? Reactive oxygen species, nitric oxide and complement protein. This neuropeptide substance P involves in transmitting pain signal. Neuropeptides means it acts on the nerves. Okay. All are mediators. Okay. So all are mediators. All are messengers. Okay. You want? See, COX-1, COX-2 inhibitors, I explained it very elaboratively and it is also in the video, so that's why I paused, because I didn't explain much about steroids. That's why I explained now. Right? So COX-1 and COX-2 inhibitors, I explained it in the class as well as it is well explained in the video, very slow. We are giving the video, okay? So it is explained very slow. See, cyclooxygenase is stopped by a drugs called aspirin and non-steroidal anti-inflammatory drugs. They block the cyclooxygenase, so they will reduce the fever and they will reduce the pain. Understand? So we have two types of cyclooxygenase, COX-1 and COX-2, and you should read it because it is very, very important. Because you want me to tell again? No. Yeah, I explain. Okay, sure. Okay, so chronic inflammation is a inflammation of longer duration. Chronic inflammation is an inflammation of longer duration. It is there for longer period. Okay, it is there for longer period. Understand? So the cells involved are mononuclear cells. So mononuclear cells means lymphocyte, macrophage. In the blood we give it a name monocyte coming out of the blood, it is macrophage. Okay, and plasma cells. Okay, it is, I will explain in the immunology, but you understand this is very, very important. What are they? Mononuclear cells, lymphocytes, monocytes, macrophage. Okay, monocyte comes out of the blood, it is called macrophage. Okay, so they will always produce fibrosis. So why there is inflammation, chronic inflammation? Because of these reasons. Okay, anything which persists in the body for longer period, whether it is a bacteria or whether it is a virus, or you are putting somebody's kidney in your body, okay, in kidney transplantation, or the person is putting silicone implant. Okay, so this all the substance is going to be there in the body, triggering the inflammation for longer period. So that will lead to chronic inflammation. Understand? So this I explained it how the macrophage takes the bacteria and releases the interleukin 12 and activates the T lymphocyte. T lymphocyte releases the interferon gamma. Interferon gamma goes to the blood, brings the monocyte into macrophage and directly activate the macrophage, and again the cycle continues. Understand? In the end, they kill the bacteria, the macrophage will die and they will produce, this is very important, okay, don't forget it, and they will produce what? This kind of granuloma, okay, this kind of granuloma. Okay, let's go one by one. So the granulomatous inflammation is a type of chronic inflammation. It's a type of chronic inflammation. Okay, it's a distinct pattern of chronic inflammation characterized by, surrounded by aggregates of activated macrophages, and that is looks like a epithelioid cell. We call epithelioid appearance. Okay. So tuberculosis is the best example to study this disease. Okay, tuberculosis is the best example. Tuberculosis produce what type of granulomatous inflammation? Caseating granulomatous inflammation. Caseating, because it produces caseating necrosis. Okay, caseating granulomatous inflammation. Okay, sarcoidosis produce what? Non-caseating. Okay, just you remember this. Inshallah, in the respiratory module, I explain more. Non-caseating granulomatous inflammation. Okay. So, you want to see? Because caseating granulomatous inflammation, the center area they will have a necrosis. Non-caseating they will not. Now, non means no. Okay. So we use non-A like that. Okay, in English. Okay. So it is granulomatous inflammation. See, you are seeing the center necrosis, caseous necrosis, yeah, and surrounded by very large cells. No, you forgot Langerhans multinucleated giant cell. The epithelioid macrophage all join together and they form a huge cell. Okay, that is Langerhans. Okay, multinucleated giant cell. Yeah, they all coalesce. Okay, they all join. Okay, and the activated macrophage are called as epithelioid cells. Okay, if you see this, always we will think it is tuberculosis. Okay, because tuberculosis is so common and they will produce this inflammation. Okay. So systemic effect of inflammation. And systemic effect of inflammation, first is fever. Okay, when there is inflammation, when there is infection comes, inflammation gets activated, immediately the person gets fever. Okay, why the fever comes? Now we all become master in that. Because of increase in prostaglandin. Why the prostaglandin increase? Because inflammation increase what cytokines? Acute inflammation increase what cytokines? TNF and IL-1. TNF and IL-1 activate what? Phospholipase. Phospholipase break phospholipid. Then TNF and IL-1 also activate cyclooxygenase. That will break arachidonic acid. In the end, we get good number of prostaglandins. They all go to the hypothalamus. Okay. Hypothalamus is a part of brain which controls our body temperature. Okay. What they do is, prostaglandin goes to the hypothalamus. They will set the temperature to higher point. They will set the temperature to higher point. So we get fever. So if you reduce the prostaglandin, then the temperature comes down. Okay. So they will become normal. So you should not forget the hypothalamus, prostaglandin and interleukin 1 and TNF, which activates the cyclooxygenase, and they will make prostaglandin. Understand? Shall I change? Okay. Now you all know the liver reacts to the inflammation, right? Liver reacts and liver produce three types of protein. What are they? C-reactive protein, fibrinogen and serum amyloid A. Okay. C-reactive protein, fibrinogen and serum amyloid A. Why it is very, very important? In the lab we do the test. Okay. The clinician will ask me to check for C-reactive protein. So if it is increased, he will think the person is having inflammation. Okay. So CRP is increased, it is a sign of inflammation. Okay. If the person is having necrosis, Okay, so whether is inflammation is severe or not, they will just check the CRP. Okay, so if CRP is increased, is having too much of inflammation. Understand? Okay, now I'm little bit mixing three principles here. Let's see how you are able to understand. Okay, remember ischemia, reperfusion, injury. Okay, I told ischemia means what? Loss of blood. That creates what? Hypoxia. That creates what? Cell injury. So cell injury going for irreversible. Cell goes for necrosis. Necrosis contains lot of enzymes. Cell is dying, full of free radical. They are invading inflammatory cells. Now inflammatory cells are coming and trying to clear it. Okay, so now inflammation is active. Okay, when the inflammation is active, all the inflammatory cells are active in the body. Okay, all the inflammatory cells are active. Understand? Okay, so if this is the situation, if I am a cardiologist, if I am going to bring back the blood, understand, it will what happen, it will bring the blood. Now the inflammatory cells in the blood are very active. Understand? They will come and they will destroy more. Understand? Clear? They will come and they will destroy more. Okay, so as a clever doctor, okay, what I will do is I will check his CRP. If CRP is high, I will wait for bringing back the blood or doing some surgeries. Okay, I'll let the inflammation settle, fever settle. These are the signs. Understand? Then CRP settles is evidence. Okay, and let them settle, then I will treat. So it will not produce ischemia, reperfusion injury. No, we give drugs. Okay, anti-inflammatory drugs. Okay, so it will settle and then we will treat. Understand? So it will not create ischemia, reperfusion injury. Understand? Okay, so this is all the background knowledge you should have when you are handling the patient. Okay, so next is fibrinogen. Okay, fibrinogen is increased in inflammation. The liver secretes lot of synthesis, lot of fibrinogen and throw in the blood. See, the fibrinogen is like a cement. Just to think, okay, there is a brick, okay, and there is a cement. Then you are keeping the brick. Now the brick is the RBC. Okay, you all know brick. Yes. Okay, brick is the RBC and the cement is the fibrinogen. So you are putting the brick over the cement, then cement brick, RBC fibrinogen, RBC fibrinogen, RBC fibrinogen. Understand? So it is like placing the coin one above the other. Understand? So the fibrinogen bring all the RBCs together. Okay, make the RBCs to come together. Okay, so it is like piling of coins. Okay, yeah. Alhamdulillah, mashallah, this country doesn't have gambling centers. Alhamdulillah. Okay, because it's old days of mine. Okay, if you go to the gambling center, we make piling of coin, just throw it. Okay. Okay, so anyway, fine. So now understand. So that is just I'm giving some example. I got bad example. Okay. So it is piling of coin. Understand? Yes. So this piling of coin type, it happens in the, if there is more fibrinogen. Okay, if there is more fibrinogen, it happens. That is called, we are going to give you a terminology now. That is called Rolex formation. That is called Rolex formation. Okay, Rolex. Okay, don't think of watch. Okay, it's a Rolex formation. Understand? So, and that increase the erythrocyte sedimentation rate. So we do a test called ESR. We do a test called, this is a very very old test in the lab, 60 years 70 years old test, but if old physician, they still prescribe this test, we do it. Okay, but new generation people, they prescribe CRP. Okay, both tells the same thing. Okay, yes. So ESR is becoming fast in inflammation, in fibrinogen, because fibrinogen is increased. Yes brother, what's the question? Yeah, Rolex is the concept in erythrocyte sedimentation rate test. Understand? ESR is a test we do in the lab. What is happening? The Rolex formation is happening. Understand? Yeah, in the inflammation. Okay, if the inflammation is severe, the roller formation will be severe. Okay, more fibrinogen comes out. Okay, so this is very important, because in the lab, if you go if you with fever or anything, the doctor will prescribe first complete blood count. They will ask you to do complete blood count. Okay, complete blood count means we will count all the blood cells in your body. Okay, by taking the sample. Okay, nowadays alhamdulillah we have a very good machine. Previous days, 10 years before and all, it is very difficult. We have to manually count. Understand? Now we have alhamdulillah very good machines. Okay, so it is very accurate, these machines are. Okay, than manual count. Okay, so for example, if you are having inflammation, WBCs are involved, right? Leukocytes are involved. So the increase in leukocytes happens. Understand? Increase in leukocytes happen. Increase in leukocytes is called, leuko means white, cyto means cell, white blood cell, osis means increase, leukocytosis. Understand? Okay, you should know what type of WBC is increased. Okay, what type of WBC is increased? If it is acute inflammation, what cell will be increased? Neutrophil. Okay, if it is a chronic inflammation, what cells will be increased? Lymphocytes. Okay, so see, we are measuring the blood. Okay, we are not measuring in the tissue, because macrophage in the tissue. Okay, so in the blood, what cells will be increased? Monocytes will be increased, lymphocytes will be increased. Understand? Lymphocytosis. Okay, neutrophils are increased, it is called neutrophilia. Okay, in general, in acute inflammation, neutrophils are increased. Okay, understand? Okay, if it is specific bacterial, neutrophil will increase. Understand? If it is specific bacterial, neutrophil will increase. Okay, I am going to tell some specific. If it is mycobacterial, which cell will be increased? Lymphocytes. Okay. If it is asthma, allergic, if it is parasite, if it is fungus, eosinophil will be increased. Okay, eosinophil will be increased. Inshallah, I will tell in the RS module why eosinophil is increased. Inshallah. Okay, now you understand eosinophil is increased. It is called eosinophilia. Right? Okay, but you understand whether bacterial or acute inflammation, neutrophils are increased. Viral infection or mycobacterial infection, lymphocytosis. Asthma, allergic causes or parasite, eosinophilia comes. Understand? Okay. Yeah. So now some infection reduce the WBCs. Okay, that is called, okay, that is called leukopenia. That is called leukopenia. Understand? Some inshallah I will discuss why it happens in the immunology module. Now understand, some infection reduce leukopenia. Okay, so that's why I am telling, don't throw these handouts. Okay, because to prepare this handout really it took me a lot of time, because one of the difficult thing in the world is condensing the things, making the things small. Okay, so you can write stories, but making the things small is crystal. It is called, we call in teaching, crystallizing the thoughts. Okay, inshallah I hope you all know, understand. So, okay, so don't throw it out, it is very important. Now certain infection reduce the WBC, leukopenia. Okay, penia means decrease, leukopenia. Okay, you should know at this example, at least you know one example, typhoid fever. Typhoid fever is very common. Typhoid fever, it is caused by a bacteria called Salmonella typhi. I hope my spelling is correct. Okay, I don't know. Okay, Salmonella typhi. Understand? So this is the bacteria which produce this infection, typhoid infection. They produce typhoid fever. So it creates leukopenia. Okay, it creates leukopenia. Alhamdulillah, I'm finishing this. Okay, so I hope you all understand inflammation. Okay, inshallah, in the next class we will see tissue repair. Right?